Alright, welcome back. We're going to talk about Chapter 3, focusing on ethics. This is the agenda for the lecture. I'll go over the Belmont Report, risk-benefit assessments in a little bit more detail. We'll talk about informed consent and debriefing in detail. I'll go over the two review boards, one for human research, one for animal research, and then talk about APA ethics just briefly. So you should have read about the Belmont Report in your textbook. This was published in 1979. It set forth 3 basic ethical principles for research with humans. Okay, the 3 basic principles are beneficence. That's just a fancy way of saying maximizing the benefits and minimizing the risks or potential harm. And this requires a risk-benefit assessment, which we'll talk about in more detail. Autonomy, which is respect for persons, and then finally justice. So we're going to focus first on beneficence. And remember, I just said that this entails doing a risk-benefit assessment. Researchers need to assess both risks and benefits in order to maximize the benefits and minimize the risks that the participants face while being a part of the study. So first we'll talk about potential benefits in psychological research. Some are direct to the participant and some are kind of less tangible, more indirect. So first, some direct benefits. They could gain some educational benefits, so they learn something as part of the participation, or they gain a new skill, or as is often seen in research on treatments for psychological disorders or medical conditions, they may get treatment or medication for one of those. Another direct benefit would be material benefits. So this is any sort of compensation that the participant gets while participating in the research. So they may get paid some sort of small amount in cash, they may get a gift card, they may get paid for mileage, commuting back and forth to the lab. They may get some sort of prize or gift, or maybe entered into some sort of drawing. A less tangible benefit is personal satisfaction. Okay, so the person feels good about being a part of science, being able to contribute to gaining knowledge or some scientific research field. So again, this is much less tangible than the other direct benefits. Some risks in psychological research. One would be physical harm. This is probably the worst type of risk. It is the most rare, especially in psychological research, but it is possible. This could include any sort of medical procedures. Okay, so for example, administering a drug like alcohol or caffeine, or depriving people of sleep for extended periods of time, anything that could potentially cause some sort of physical harm to the individual. Next we have psychological stress, which is more common than the physical harm in psychological research. For example, participants might be told that they'll receive some extremely intense electric shocks, if you remember the Milgram experiment, and they actually never receive those shocks, but it's the fear or anxiety during that waiting period that is the variable of interest there. Okay, so that would be psychological stress. But any study that induces anxiety or negative emotions in an individual would fall under this psychological stress risk. And then last, this is really important for all researchers, another risk is the loss of expected privacy and confidentiality. Okay, so researchers have to take very special care to protect the privacy of individuals. Okay, so at a very minimum, all the data should be locked in a secure place. Okay, in a locked room or locked file cabinet, and only people who should have access to that material should have a key. Confidentiality becomes really important when studying very sensitive topics, so things like sexual behavior, divorce, family violence, drug abuse, domestic violence. In these cases, those types of studies end up asking people very sensitive questions, and their responses could potentially be harmful to themselves outside of the study. So it's really important that their names are not linked with their responses, and again, that their data is kept private. Okay, so researchers would have to assess both of these, the risks and the benefits, and try and reduce the risks as much as possible while increasing the benefits. That second ethical principle from the Belmont Report is autonomy. This is respect for persons. Right, this states that participants are treated as autonomous. Okay, they're capable of making decisions about participating in research on their own. And what gets applied here, or how researchers meet this criteria or this guideline, is by doing what's called informed consent. Okay, so potential participants, people that are being recruited into a study, should be provided with all information that might influence their decision on whether or not to participate. So generally, the informed consent form, which is typed up in a nice, usually one-page kind of letter, covers the purpose of the research, the procedures that will be used, including the amount of time involved. Keep in mind here that we don't usually tell the participants exactly what is being studied. We also have to include in this form the risks and benefits, any sort of compensation that they'll be receiving, how we are going to ensure confidentiality, and then also a statement explaining that all participation is voluntary and that the individuals are free to withdraw at any point in time during the research process. And then last, it usually has contact information for the researchers in case the participant has any questions. Okay, so on page 45 in your book, there's this checklist here. Right? You don't need to write this down in your notes, but you can review it in your textbook. It goes over some of the information I just gave, but then also talks about the basic formatting of this. Obviously, it should be legible. We also usually write these at about a 6th to 8th grade reading level so that all participants can understand. And at the bottom of the form is a place for both the participant and the researcher to sign. There are some issues that come up with informed consent. Okay, first, there are special populations such as minors, patients in psychiatric hospitals, or adults with cognitive impairments that may require special precautions. Okay, so with minors, you have to get written consent from the parent or guardian, as well as what's called assent from the minor participant. Okay, those in psychiatric institutions or, say, adults with cognitive impairments may have someone who makes those types of decisions for them, and so you would have to get consent from that individual. Another issue with informed consent is coercion. Like I said previously, all research is voluntary, and people are free to withdraw at any time. Okay, so this means that people are able to turn down the researcher at any point, so it can be during the informed consent process, or it can be after they've already agreed to participate. They're able to leave, and the key here is that there should be absolutely no consequences for leaving a study. Okay, and this corresponds to HPP as well. So if you sign up for a study, that is for a course to get course credit by being a participant in research, it doesn't matter the reason for you participating in the research, you're still able to walk out at any time, and you would still get the course credit for showing up and attempting to participate. All right, along with this is an issue that comes up with compensation. You don't, as a researcher, want the compensation to be so high that you make it impossible for someone to turn down. Okay, so the compensation should really match the amount of time and effort that the participants put in. This is why a lot of researchers, particularly in biomedical research, will compensate for mileage. Okay, so the driving that a participant has to do between their home and the facility where they're participating in the study. Another more recent issue that's come up with informed consent are issues regarding online studies. Okay, so a lot of studies are now being put online, especially survey research, and you still have to go through the informed consent. So they usually have a statement at the beginning explaining the study, and then if you check a box or you hit continue or submit, then you're giving permission to be in the study. Obviously, you can withdraw and just not finish at any time. However, who's to say the person actually read the informed consent? There's no one there handing it to them or no one there explaining it to them in person. And then there's another issue that comes up with these online studies, is that if it requires someone to be 18 or over, okay, usually there's a checkbox for this. Who's to say that the person on the other side of the computer is actually over 18? And if they're under 18, how are we to obtain their parental or guardian consent? So a couple of things that come up with informed consent are some issues regarding how much information we give to the participants. So most of the time we give the kind of minor minimum amount of information to explain the study so that they have enough to make an informed decision, but without giving away what the exact hypothesis is for the study. Because people tend to respond in ways that are either socially desirable or in ways that they think will be helpful for the researcher rather than in accurate, honest ways. So if they know your exact hypothesis, they may change their responses or change their behavior to try and help you out and support your hypothesis, and you don't want that to happen. So most researchers, if too much information would lead to a change in the results, will withhold information. Okay, and this is generally acceptable. You withhold information whenever the information would not change the decision to participate, and the information will be provided later. Okay, most people who volunteer don't expect complete, full disclosure about the study prior to participating, but they do expect some information afterwards, which we'll talk about in a minute. Deception is what happens when there is an active misrepresentation of the information. Okay, so if you think back to the Milgram experiment that you read about or learned about in your intro class, there were two types of deceptions going on here. First, the participants were deceived about the purpose of the study, so they were told that the study was about one thing when really it was about something else. So remember, they were told that it was about learning and how to teach a word list to other individuals, when really it was about obedience. And then second, the Milgram study also illustrated a type of deception in which the participants became part of a series of events staged for the purposes of the study. So remember, they had an actor in on it, so they were told the other person was a participant, but really it was what's called a confederate, a person who's in on the study who plays a part of another participant. Okay, so in order to study obedience to authority, Milgram had to set these things up. Okay, tell the participants that it was about learning, and tell them set up this kind of staged situation. So those types of deception have been most common in the kind of subfield of social psychology, but it's much less frequent in areas of experimental psychology, so things like human perception, learning, memory, motor performance. But even still, even though it's been a little bit more common in social psychology, it still hasn't been that common. Right? So is deception a major ethical problem in psychological research? Most psychologists believe that the problem of deception has been greatly exaggerated, and that the examples of these really elaborate deception that's been cited by critics are actually very rare. And so things like the Milgram experiment or the Zimbardo Stanford Prison Experiment study, where you see this kind of major deception going on, again, are very, very rare. And one of the things I said earlier is that if we withhold information, then we end up giving that information at a later time. Well, that is part of what's called the debriefing process. Okay, so after completing the study, if a researcher withheld any information, then the participant is told that information at the end. And if there was any deception, the debriefing process explains why that deception was necessary. Okay, so you would tell the researcher, in the beginning we told you the study was about X, really we're looking at Y. Here is the reason why we couldn't tell you about that in the beginning. Also at this point, we usually give some additional resources if necessary. So for example, if there is a potential physical harm where, the participant may want to talk to a health professional, then we can give those resources. Or if there was stress and anxiety involved in the study, we can give phone numbers to call or clinic numbers to call if they have any problems that come up as a part of being in the research. But the main goal of this debriefing process is to make sure that the participant leaves the experiment without any ill feelings towards psychology in general. Right? You want them to have a good experience. You want them to understand the research process and to potentially be a participant in the future. Okay, so again, this gives us an opportunity to explain the purpose of the study further, maybe explain the anticipated results. Most participants, studies show, report positive experiences after leaving a participation. And research suggests that this debriefing process is actually effective in helping that positive experience. So like we said earlier, that deception is fairly rare. There are some alternatives to using deception that researchers can implement instead. The first is role-playing. Okay, in role-playing, the researcher asks the participant how they would respond to a certain situation, or in some cases how others would likely be responding to that situation. So usually this involves the participant either reading a scenario or the researcher telling them about a scenario, or maybe they even watch a video with this type of information, and then they do some sort of self-report measure where they answer questions on a questionnaire, or the researcher just asks them the questions directly. This, however, is not considered to be a satisfactory alternative to deception because self-report can be misleading. If you're asking a person to imagine a scenario and to respond how they would behave, it's not necessarily going to match up with how they actually would behave if they were in that situation. Okay, so we can think of one example if we're interested in crime and how people respond when a crime happens nearby. If you ask them to imagine you were sitting, at a bus stop bench and someone runs up and grabs your neighbor's purse, what would you do? You may get a very different response to that kind of imagined scenario than if you actually witnessed that crime happen. Okay, so again, typically people want to be helpful and they also want to give a socially desirable response, meaning that they want to put themselves in a good light and respond in a way that society would think is acceptable. So if you have them imagine, again, this fake crime and what would they do, they may report things like they would immediately get up and chase down the bag snatcher, call the police and so on, where more often people actually don't do anything. They either freeze or they think it's, someone else is going to step in. So what they imagine they would do and what they would actually do may be very different things. Another alternative, kind of a step up from the role-playing, are simulation studies. Okay, so this is a variation on role-playing where you simulate the real-world situation rather than having them imagine it or read it. Okay. So, for example, you could have a situation set up where there's, a fake argument going on, or if you want to look at driving behavior, you can use a driving simulator, a machine that simulates the actual environment that the person would be behaving in. Or you could do this with kind of mock juries. You set up a fake courtroom, you have actors or confederates playing the roles of the lawyers and the defendants and so on. And you can get a better sense of how people would actually behave or respond in the situation. Okay, and this has a high degree of involvement from the participants, so they are kind of immersed in this fake situation, this simulation, rather than just imagining it, which is very passive. And last, we have honest experiments, and this involves situations in which naturally occurring events present opportunities for research. Okay, so for example, researchers can study the effects of crowding on academic performance by going to schools where overcrowding is already an issue. Okay, there are some dorms that are crowded, some that are uncrowded, and they can randomly assign the incoming students to these, and then measure some academic performance variables at the end, instead of setting up fake crowding in a place where that wouldn't be naturally occurring. Okay, or having people imagine, again, what they would do or how they would behave if they were in an overcrowded dorm. Right, so these are convenient. You're taking advantage of something that's already happening in order to collect data. Okay, so another couple of examples, if you're interested in dating behavior, rather than have people imagine they're on a date and ask them questions, or setting up a fake date for someone, you could actually go out into the real world and maybe go to speed dating events and see and record how people behave at those. And that last, the third ethical guideline or ethical principle from the Belmont report was justice. Okay, so this has to do with the selection of participants and also who receives the risks and benefits. Okay, so this principle of justice addresses issues of fairness in receiving the benefits of the research, as well as bearing all the burdens of the risks that are inherent in the study. And this also requires researchers to address issues of equity. Okay, so any decisions to include or exclude certain people from a study must be justified on scientific grounds. Okay, so for example, if you wanted to exclude certain age groups or ethnicities or genders or so on, it has to be scientifically justified. Right? This guideline really came about because of the syphilis studies that went on, and you read about this in your book, from 1932 to 1972. There were about 400 poor African Americans living in Alabama who were not given treatment for their syphilis for the researchers to be able to track what happens during the course of the disease. Okay, so rather than being treated, they were allowed to have the syphilis run its course so that researchers could collect data on the disease itself. Okay, so when they were coming in for the research, they were not given any information about treatments or treatments being available, yet other individuals outside of the study were being given access to the treatment and the kind of benefits from this syphilis study. Later in 2011, more evidence surfaced about another syphilis study in Guatemala, where between the years of 1946 and 1948, men were infected with syphilis without their permission. Okay. So in both of these cases, people were included in the study based on certain demographic characteristics and received risks of the study, while other people got the benefits. Okay, so that is one of the major things that this ethical guideline wants to avoid in the future, making sure that we only include or exclude people based on some sort of scientific justification, and that everyone shares in the risks and benefits equally. Okay, so I'm going to talk a little bit about the review boards that all researchers have to go through if they want to do a research project and collect data. The first is the Institutional Review Board, also known as the IRB. Federal regulations are the ones that set up the Institutional Review Board requirements. So this is done by the U.S. Department of Health and Human Services. And under the regulations set up by them, every institution that receives federal funds has to have an IRB that is responsible for reviewing all of the research conducted within that institution. Okay, so that's all research conducted by students, faculty, and staff. It doesn't matter who is doing the research. If the institution gets federal funding, they have to have an IRB. Okay, and so again, I want to point out that this means the institution gets the funding, doesn't mean that the researcher is federally funded. Again, they're responsible for reviewing all research involving human participants that occurs at that institution. There are some guidelines for who has to be on the board. It has to have at least 5 members, and one of those members has to be outside the institution, so someone not affiliated with the school or research facility, someone who would be a community member. So I'm going to go a little bit about the IRB at Cal State San Marcos. Okay, CSUSM is a federally funded institution, so they are required to have an IRB on site. The IRB website at Cal State San Marcos provides the information you see here on the left. There's training that all researchers have to go through in order to conduct research with human participants. So the main researcher, as well as any research assistants, have to go through this training. And the training has to be renewed every so often. Usually it's about every 3 years, so that any updates can be provided in the new training. All of the forms that a person needs to fill out are on the website, as well as instructions for the consent form, the format that the school wants researchers to follow, and then the whole process is laid out on the website as well. On the right here you see the current IRB at Cal State San Marcos. There are 2 chairs, one from the psychology department, one from education, and then you see everyone else listed down below is a board member. So you can see that they're from various areas at the institution, and then you see about halfway down we have Carol, who is the community member, and then you see also here we have a graduate student who's on the board. Okay, so there are 3 kind of main types of research that get reviewed by the IRB. The first is exempt research, okay, where no review is needed. This is research where there is absolutely no risk of harm. So things like anonymous questionnaires and surveys or educational tests that are part of kind of normal educational practices would be considered exempt research. So would naturalistic observation in public. So if we observe completely public behavior where there's no information collected from the individual, there's no threat to anonymity, then they can go through this kind of exempt, no review needed process. The next step up from that is minimal risk research. This is a second type where the risks of harm to the participant are not greater than what they would routinely encounter in their daily life. Okay, so this would include routine physical or psychological tests. So most of the standard kind of psych measures would be in here. Voice recordings where there's no danger of confidentiality breaches. Cognitive and perception research where there's no stress involved. Right? Routine physical tasks that someone would face kind of in their daily life. And this goes through the routine review conducted by the IRB. And then last we have greater than minimal risk research, and this is any procedure that places participants at more than that minimal risk, so more than what they would encounter in their day-to-day life, has to go through a very thorough review conducted by the IRB. Okay, so this is any research that involves any physical or psychological stress, involves invasion of privacy or sensitive information. And most of these require complete informed consent and other safeguards to be put in place before approval is granted. Okay, so as you can imagine, going through these three takes different amounts of time. So this next slide shows kind of the overall estimate of time that it takes to go through the approval process. So exempt, low to no risk research takes about 2 to 3 weeks. The kind of expedited minimal risk research takes about 3 to 4 weeks. And the full board review that has the high risk involved can take over a month. Okay. Some researchers have voiced their frustration with this process because it can take a long time. The boards can ask for revisions and clarifications, which then extend these times that you see here. And then these policies and procedures that govern the IRB apply to all areas of research, anyone doing research with human participants. So the same extreme caution that's necessary for medical research with humans is also applied to psychology research. Okay, so everyone is held to the same standard through the IRB regardless of the field that the research is being done in. Okay. This is the process for IRB at Cal State San Marcos. You do not need to write this down. I've also put a copy of this online for you. You see over here on the left is the exempt research. It gets reviewed by the IRB office, and at Cal State San Marcos it takes about 1 to 2 weeks. The expedited review, the review gets assigned to one IRB member, and the member is chosen based on their expertise and how much time they have to do the review. And this takes about 2 to 4 weeks. And then the full review, that next step up, where there is greater than minimal risk involved. First, 2 members are assigned as the kind of primary reviewers, again based on their expertise and how much time they have. And then at the next full committee meeting, those members present the information about the proposal. The full committee reviews the proposal and makes a decision. And that here can take, or at Cal State San Marcos, can take about 4 to 6 weeks. And it depends again on the timing of these full board review meetings, because they don't happen, say, every week. Okay. Next, I said there is potential for revisions to be asked for, or clarifications. So if this happens, if there are any changes in the risk involved, or it was originally a full review, then it has to likely go through full review again. If it was an expedited review and there was no changes to the risks, then usually it's just reviewed again by one committee member. And these revisions usually take about 1 to 2 weeks. But again, it depends on how much needs to be changed and whether a full review is required. Another thing I want to point out is that once you get permission to do a study, you are confined to the information you provided in the application process. So you cannot change the procedures or the timeline for the study without having it reviewed again. So if you want to extend beyond the period where the committee said you were allowed to do this research, you would need to file a continuation, and that gets reviewed as well. So if it was originally a full review, it will be reviewed by the full committee again. If it was originally expedited, they'll try and get the original person to look over that and approve the extension. Okay, and that usually takes about 2 to 4 weeks to get approval. And then usually coursework or any kind of instructional review, so things that are being done in classrooms, is just reviewed by the IRB chair. Okay, so all of that applies when someone wants to do research with human participants. So what happens then if they're not doing research with humans, but instead are doing research with animals? Well, it's a very similar process, but it's a different committee that they have to go through. Let me go back real quick. Sorry about that. Okay, so with animal research, this is guided by a different set of rules and regulations that were put forth by the Health Extension Act in 1985. So this specified guidelines for the care of animals. with the main goals being humane treatment of any animals in research, that we limit their use as much as possible, and that we limit the distress of the animal. And the guidelines are very strict for animal care, and they include proper treatment, which includes proper nutrition, proper housing, and so on. Research institutions that have these animal care committees that review the research for approval have to address these few things. First, the research should be relevant to human or animal health, advancement of knowledge, or the good of society. Okay, so it has to be important research to get done. Also, alternative methods that don't require animal subjects should be considered by the researchers, so they have to make an effort to at least look into those and use them where possible. So this may include computer simulations instead of actually using animals where applicable. And then last, procedures that are a part of the study must avoid or minimize the discomfort, distress, and pain of the animals in the study. So these reviews are done by what's called the ICUC, the Institutional Animal Care and Use Committee. Just like the IRB, there is an ICUC board at Cal State San Marcos. Their website also contains training, forms, instructions, and so on. And this is overseen by the Office of Laboratory and Animal Welfare. Just like with IRB, anyone doing research with animals has to go through the training process and receive a certificate before they can actually collect any data. Also, just like the IRB, the ICUC is required to have 5 members, but there are more restrictions on who those members have to be. Okay, so of the 5 members, you have to have 1 vet, 1 scientist, 1 non-scientist from the institution, 1 community member, and then the 5th person is free to vary and be any of those. It's usually another scientist from the institution. Okay. So again, these go through and review all research involving non-human vertebrate animals. It doesn't matter where the funding for the research is coming from. Again, if the institution is getting federal funding, the institution has to have this committee and follow the procedures for approving the research. Again, making sure that it's relevant research, all alternatives have been considered, and that the researcher is reducing or minimizing any sort of discomfort, distress, and pain of the animals. Also that the individuals are taking into account the welfare and health of the animals. So any laboratory animals have to have a vet either on staff or off-site that is dedicated to providing treatment for the animals when necessary. The facilities where animals are housed have to be inspected either by the federal government, usually the USDA, or by the vet on the ICUC board. I'm not going to spend a whole lot of time on this, but I just do want to briefly mention the importance of animal research. We really owe a lot in terms of human health to using animals in research. So we would not have all the advances in medicine, drug treatments, and treatments of disorders if we did not do animal research. Okay. So surgical procedures, pain relievers, psychoactive drugs, medications for blood pressure, insulin, pacemakers, nutrition supplements, organ transplants, treatment for trauma or blood diseases. These things have all been developed and tested in animals before being used in humans. Okay, so according to the American Medical Association, virtually every advance in medical science in the 20th century, from antibiotics and vaccines to antidepressant drugs and organ transplants, have been achieved either directly or indirectly through the use of animals in laboratory experiments. Okay, so animal research in medicine and also in psychology have provided huge advancements and improvements in human health and well-being, and obviously we'll see more of these advances in the future. But also we learn a lot about animals when we're doing animal research, and we have benefited the health and well-being of animals themselves. So we've learned a lot more about animal training, okay, better farm management techniques, how to, again, treat livestock, pets, or wildlife that have been injured, nutrition, medication, housing requirements. All of these things can benefit the animals directly. And also, some animals do suffer from the same diseases that humans suffer from, and so any treatments that we develop for those can also be used to treat the animals themselves. Okay, for example, dogs do get leukemia like humans do, so any leukemia treatments that are found via animal research can help those animals as well. Last, I want to just touch very briefly on the APA Ethics Code. So most professional organizations have their own set of ethical guidelines that they expect members or people of their field to go by and follow. Now these, you have to keep in mind, are in addition to any federal ethic guidelines. Okay, these are not replacing those, these are on top of those. Okay, so the APA, the American Psychological Association, has their own ethics code for human research and ethics in other psychology-related fields outside of research, as well as some animal research guidelines as well. Okay, so the 5 basic general principles in the APA Ethics Code are beneficence, responsibility, integrity, justice, and respect for the rights and dignity of others. You can see that these overlap with some that were established with the Belmont Report. Okay, so these get updated and amended periodically, and they're all available on the website for the APA. And you can read more about them in your textbook as well. Okay. Also within these ethics codes for APA are 10 ethical standards that address very specific issues that have to do with the conduct of psychologists in various fields. So things like teaching, research, therapy, counseling, testing, and other professional roles and responsibilities. Okay, so they have, information and guidelines on client and patient interactions, student interactions, mentoring students or interacting with research participants, the types of compensation that can be involved in research, using deception, debriefing, all the same types of things as before. But then also information on plagiarism and student-teacher interactions. And then they also have some animal care guidelines for research as well. Now you can read more about some of those in your book, and if you're really interested, you can go to the APA website. It's apa.org to look up more about those. Okay. So that about sums up our lecture on ethics. If you have any questions, be sure to bring them to class with you, or you can also send me an email before we meet.